Hello everyone, welcome to Trenton Pet Hospital's third and first of the new year Chat with a Veterinarian, Coffee with a Veterinarian. Hope everybody had nice holidays and recharged. We were fortunate enough to be off for the week, so I think we've come back with some more juice in our batteries and lots of new exciting topics to discuss. Of course, lots of feedback, which has been nice. So we've kind of changed things up a little bit. We're now in front of the fireplace. Hopefully everybody's been safe with this crazy weather we're having. Dr. Ginny wanted to talk to us and you guys today about tick-borne diseases, which is something we're facing absolutely every day. There's a lot of misinformation, myths, questions, just a lot of unknowns we find from the general public and pet parents about ticks and tick-borne diseases. So we thought it'd be a great topic. Of course, we encourage you to submit your questions. And you all know Dr. Ginny, so she's going to start. I do have some questions that we'll go through later, but again, feel free to send them through.
Well, hello, wonderful pet parents. I hope you're all well, and I hope our last little chat on how to prevent your pet to be in an emergency situation helped you to stay out of the emergency. I do know that we had actually, believe it or not, lower number of emergency records than we usually do.
It was nice to come back to that.
It was nice to come back to that. Andrew is completely right. So that makes us, I'm sure, feel quite good. But I do want to talk a little bit about the tick-borne diseases. We usually, in the winter, we kind of relax a little bit and we labor under misconception that ticks take winter off. And the fact is, ticks do not take winter off and they're still around. And I would say that one of the highest numbers of Lyme disease we diagnose is exactly in the spring as we're coming out of winter. So what's also becoming a little bit of a concern, we are starting to see some unusual tick-borne parasite diseases, which we haven't seen in the last few years in Ontario. Actually, they're not common in Ontario. And specifically is anaplasmosis and Ehrlichia. And those particular parasites are definitely traveling from south of our border to Ontario, and they are here. And because of climate change, I guess, and
Snowbirds, people taking their pets, yeah.
And well, I read some studies that actually we are to blame the birds, okay? So the birds, as they migrate from southern states from southern states to Canada, I guess they dropping ticks left, right, and center. And because our temperatures are becoming much warmer than usual, ticks are actually finding homes in Ontario. It's a bit unusual, it's a little bit scary because we don't really, we don't see those diseases as often and we may not recognize them right away. But also the clinical symptoms they bring are a bit scary, right? For example, anaplasmosis will destroy red blood cells in your pet, right? So, and sometimes by the time we diagnose your pet with anaplasmosis is because your pet is having some bleeding or is very pale, anemic. So obviously I felt that it would be good for us to chat today and talk about why is it such an amazing idea to continue your pet on a flea and tick prevention year round, not just in the spring, not just in the summer, but in the winter as well. So ticks, we actually did a test on a tick. We put barely a live tick, we pulled the tick off the dog, we put it in a Ziploc bag, and the Ziploc bag we put in a freezer, okay, freezer, where things get frozen solid, okay, and we pulled out that tick 2 weeks later. Well, guess what? Guess who was well and alive and had no issues whatsoever?
I think it was better when it came out than before it went in.
It was that tick. So it just tells us that the freezing temperatures need to be really, really low, -10 if not more. and for a very prolonged periods of time to actually do anything with a tick. In fact, the temperatures between -4 and I believe 4 degrees or something like that make that tick even more reproductive than warm temperatures. How insane. So what we're trying to say, and not to mention that there is no prolonged freezing weather anymore. Am I correct?
We can barely go out and skate. The things are not freezing.
Yeah.
The thaw temperature, and it doesn't take very much. Nice, little bit of a nice sunny day,
and everything gets thawed out. So there is a lot to say about making sure to keep your pet on the tick prevention. I mean, the cost is always a concern, and of course there would be a bit of a barrier. But I was thinking, like, I was trying to figure it out, the cost of a tick prevention for, well, my dog. I have a German Shepherd dog. She's 40 kilograms, and it's approximately $90 for 3 months protection. So I have to buy it 4 times, so $270 is to protect my dog against the ticks. So if for example I don't do that and I do save those $270 and my dog all of a sudden becomes lame, let's say.
I think it's $360. It's $360.
Oh,
for 4
I'm so
boxes.
yes.
And you're the good one at math.
I know.
You're like, wait, it's almost $400, but that is so much cheaper than the alternative, which we see every day.
And sometimes what happens, the dogs become lame all of a sudden. So they don't become lame over the period of time. They become lame all of a sudden. So before you realize, well, maybe that is Lyme disease, your pet may already have gone through some diagnostics, God forbid, x-rays, that, and that. The bill pile up fast, okay? We, in our hospital, as a rule, any pet who comes in acutely lame, we always do a screen for Lyme disease. And do you know how many of them come back positive? Well, a lot.
A lot of people think, oh, my pet's lame. And I mean, lame is, I think, a term we use. I hadn't heard it very much before I entered the veterinary world. People just think my dog overexerted themselves.
Yes.
They hurt themselves. They're just taking it easy. And, you know, so it does mask the symptoms.
Yeah, slipped on the eyes.
Yeah.
Jumped off the bed, right? In reality, the pet actually harbors Lyme disease, right? So I would say that when a Lyme agent itself goes into the joints and creates inflammation of the joints, yes, it's inconvenient, and yes, it does cost money, but it is fixable. It is absolutely fixable. The trouble is, in the last year, we have started seeing cases of Lyme nephritis. So what that is when the Lyme bacteria actually goes into the kidneys. And I have to tell you, I think we had a few cases of Lyme nephritis, and I know one of those cases had to go to the emergency hospital, and I do not think that either one of them survived. The mortality rate is extremely, extremely high. I mean, I would say 80 to 90%. And by the time the parents even realize that something is off with my pet, it's not doing well, puking, drinking a lot, or whatever that is, Lyme bacteria had a lot of time to do quite a number on your pet's kidneys. So that is something also to really, really be even more concerned. And I can't even start telling you the cost of managing or like even diagnosing kidney disease. Those pets end up to be in a hospital, in emergency facilities usually, because they require 24-hour supervision. I mean, this is a big bill. Definitely would have covered the cost of a tick prevention for their lifespan, not just a year, a lifespan. So that is something to take into the consideration.
Yeah.
Okay. So we do notice that there is a lot of, not a lot, Advantix, Bayer, is it still Bayer?
Yes, yeah.
Bayer has allowed pet stores to sell Advantix in the pet stores. And one of the things is, and we're happy with that. We don't care how, as long as you use proper approved product which actually has a label, a claim against prevention of Lyme disease, okay?
And I will even go further as saying it has to have a drug identification number, what's called a DIN.
Yes.
Because we have seen at
Yes.
least 2 clients that have come in, purchased online. Fortunately, it's come from either the UK or the States, and we've submitted because the pet did have Lyme. And they think, oh, how do you have Lyme? You know, they're on prevention, and that prevention alone won't, 100% stop Lyme disease. But very curious, you send the product off to the manufacturer, and they come back, and it is actually counterfeit.
Yes.
So there are things to look at there, which is why if you're getting it from your veterinarian's office, you know that it's the real deal.
Yeah, and I would say that products like Bravecto, NexGard, Simparica, Cardelio will not be sold legally on Amazon. Absolutely will not, okay? You need to have a veterinarian dispensing the product. So if you're getting one of those products online very cheap, well, there is a reason why it is cheap, because chances are it's not a real deal. I don't know if Advantix could be sold on Amazon. I'm not sure. It's a possibility. But if Advantix is sold right now, Advantix, and it's Advantix by Bayer. That's very important, because I noticed a few parties actually started creating products with a name very, very similar to Advantix. So people will come and tell us, yeah, he's on Advantage, or he is on Advant something, and it's actually not the same thing. So Advantix usually is, I believe in the pet stores, is held behind the counter, I believe. I learned that pet stores actually have a scale now, which is fantastic. This is so amazing. But the trouble with Advantix is based on your pet's weight, especially once you get into the giant sizes of dogs. I believe it starts at 40 kilogram
Yes.
dogs. It's not every 4 weeks anymore. It's actually every 3 weeks. There is a separate schedule to follow on giant breed dogs. So if you are not sure, if you're using Advantix and you have a giant breed dog, a dog over 40 kilogram mark, please call Bayer and please double check how often you need to apply the product. If you are our clients, we will be more than happy to send you that information. We have a little schedule, and making sure that your pet is properly protected, okay?
Absolutely.
Yeah, so let me see.
I think some of the, some of the products that are coming out, like Dr. Jenny said, some of the manufacturers, the big players, the big scientific players, the big drug manufacturers, they have done so much research on this on Lyme disease, on the different ticks. They've really spent millions and millions, far more than we could ever spend on any type of scientific data. And we spend a lot of time being trained and learning anything new that's coming out. So, these are things that I don't take lightly when a veterinarian is making a recommendation of a product. I know sometimes people will say, well, what can I apply at home? I've heard things, apple cider vinegar to witch hazel and dog collars that have their anti-tick. And I just, I shudder sometimes because I know it's misinformation based on everything that we know within the clinic. And I just wish that information was a little bit more widely available. So one of the questions that came through was, Dr. Jenny, is there anything I can do at home to stop ticks?
Well, you know what? No, you can't. But one of the ways to protect your pet from, or increase the chance of your pet not getting Lyme disease, is actually physically checking your pet every single day for ticks. We sometimes diagnose Lyme disease in the pets who have not had a tick. Like the owners swear there was no tick. Well, guess what? Ticks get we've seen ticks inside the ears.
In the gums.
In
with
the
the
gums.
teeth.
We've seen them between the toes. We've seen them underneath the tail. So I think a good petting and checking pretty much all these, you know, spots, like which are, you know, we may not think twice about checking, would increase the chance of you finding those ticks and actually get them out. So here is another thing. On average, for a Lyme disease to be transmitted, it takes less than 4 hours for the tick to be on your pet. 4 hours. So any research and good quality products, the products we would stand behind, will actually have a claim that the tick will die within those 4 hours without even an opportunity to take a blood meal. So that's very important. 4 hours is your magic number. So what that means is, if you went for a walk in the woods in the morning and you're checking your pet at night for ticks, well, it's more than 4 hours, right? So if your pet is not on the tick prevention and you actually do find the tick during your check, chances are the damage has been done. The Lyme disease or whatever other diseases already have been transmitted. And we recommend to call us, and we would schedule you in to do a Lyme testing in 6 weeks, because it does take a bit of time for the body to develop the antibodies which we're testing for. 6 weeks. Do not bother bringing us ticks anymore. We don't do testing anymore. It has been the health unit has established that 75% of ticks around us carry Lyme disease. 75%. So some people will ask, well, why don't we just go ahead and dispense doxycycline? Well, we can't do that because we are stewards of proper antibiotic use. We do not want to start antibiotic resistance in ticks and the Lyme disease. So we want to make sure your pet absolutely has Lyme disease before we're going to do a course of doxycycline. And usually that course is 30 days, 1 month on average, 1 month. Okay?
So there's no magical put anything on your pet at home. I think that should be a fairly cut and dry answer. Now, one of the things that I will say that kind of makes me laugh sometimes is, you know, you do hear people that say, well, my dog wasn't in any long grass, as if ticks only survived in short grass, or I only have pavement, my pet doesn't go on the grass, you know, or I've even heard as much as my pet does not leave my yard, it does not leave the fenced yard. Ticks do not care. They are on the pavement, they are on concrete, they are in short grass, long grass, trees. You know, I think one of the myths is that people think that ticks will jump. Ticks are not jumpers.
No.
They are attaching off of things. That could be other pets, that could be you. So, you know, again, going back to some of the myths out there, it's not an if, it's a when more so now. And I think, you know, as we were saying, prevention is really the only way. And 12 months of prevention, not just, you know, 6 months. It's not just the spring and summer months. It's a 12-month type of deal. You know, things have changed. It may not have been that way years ago, but geographically, even with our weather, so much has changed. One of the things that I always try and remind people is that prevention is not the only thing that is going to stop ticks. So, you know, no claim is 100%. And I will also say that further to Dr. Ginny, people have also said, well, my pet is on prevention, but I've seen a tick on them. How does that work? Well, the prevention doesn't stop the tick from actually getting onto your pet and attaching. What it's doing is it's killing that tick before it's transmitting and getting a blood meal. So again, to sort of clarify, your pet could still, and it is still best practice to check your pet for ticks, because of course you don't want them coming in your house if you have other pets. So I think that's important.
And I would say that there is a resistance in ticks 100%. A lot of and I would say especially with advanced ticks, we are starting to see a little bit more resistance when it comes to advanced ticks, because it has been the product for probably the most number of years, Advantix and Revolution. So Advantix has what it's called hot feet effect, right? So when tick tries to attach to your pet what Advantix does, it makes their feet sensitive to the skin. So they literally will jump off. It's almost like the effect is being on a burning coal.
The floor is lava.
Yeah, the floor is lava. Well, guess what? Some ticks don't have that effect, right? Some ticks, you know, they don't care. So there is no way to have a label 100%. I always suggest three things, and I would say you're pretty much 99% there to preventing Lyme disease, tick prevention year-round, and that would be product labeled against Lyme disease, against ticks, okay? And there are specific ticks which also do need to be on a label, specific ticks which transmit different diseases.
And that's region specific as well.
And it's region specific, exactly. So tick prevention year round, checking your pet every single day, and sounds like even twice a day after each walk. And number 3, Lyme vaccination. And usually between those 3 things, we have a very, very high chance, like I would say, I don't think I've diagnosed Lyme disease on any pets doing all of those 3 things. I don't think so, no. So that is nowadays the most important things to
We've
do.
had Lyme in cases where the pets are on year-round prevention in terms of, you know, something like Brevecto, but the dosage was missed.
Yes.
The timing is so crucial.
Yes.
Even a week, a few days can make or break it.
Yeah, and I would say absolutely, I agree with that. And the age, that's very important. We have diagnosed Lyme disease in the tiny little puppies, okay? So ticks do not care, okay? So I think the youngest we've diagnosed was like 8 or 10 weeks of age, okay? And when things are developing, when things are growing, this is, I would say, is the most damage can be done, okay? So part of our puppy protocols is we will send you home every single month with a tick and flea prevention dose. We do it only monthly because, well, guess what? Your puppy grows. It grows through their... so that's another kind of, to me, using Advantix in the puppies could be questionable, because then you're going to end up with a whole bunch of boxes at home, you know, because the weight changes so fast, right? And I think we should talk a little bit, what are the options out there?
Absolutely.
Right? We should talk about that. So I find that we did a lot of research, and the research doesn't just come like, you know, we just want just any tick prevention. It is a specific ticks which are in our area. And those, not all ticks carry Lyme disease or Ehrlichia or anaplasmosis. Those are different types of ticks who do that, right? So we need a product which covers against ticks in the area which is relevant to us. So we have chosen Brevecto for different reasons, for many reasons actually. Number 1, it's a chewable, right? Chewable, it's a treat, right? So my dog, for example, I think I even have a video of my dog just shaking, wanting to have, she thinks it's a treat, right? She loves it. So very easy. I personally, being a relatively busy person, I want something which I don't have to remember all the time. So once every 3 months works fantastic.
Put it on your calendar. Her dog's a chew girl, mine is a topical boy.
Yeah, and that's another thing. For all of our very, very allergic pets, especially food allergy pets, well, guess what? Brevecto comes in a topical form, which I think it's invaluable, because you're still getting your 3 months prevention, and you're not jeopardizing your pet's medical management of the food allergies. Now, I am going to clarify myself. I know I said 3 months. In fact, Brevecto needs to be applied every 12 weeks.
Yes, that's right.
And it's very important. That's very important. Again, like timing is everything, because as the 3 months goes, the concentration of Brevecto goes down. And so you want to apply next dose, this concentration is almost there, but there is still some, and you're already getting the new dose to go high up again. You do not want to go on the curve, and there is a couple days where there is no protection, and then you apply.
Because that's what's going to happen. There's Murphy's Law. That's when it's going to happen.
Yeah, so when you do your phone, when you are programming in your phone or in your calendar, do not program every 3 months, program every 12 weeks.
Yes.
Okay.
Good tip.
Yeah.
What about, so we've talked about, for example, Bravecto. We do carry some other products depending on what the pet needs, but that's Trenton Pet Hospital's protocol based on, Dr. Ginny, Dr. Scott Weiss, there are other professionals out there. This is not just us picking something from the sky based on who we like the most. Now, do you want to maybe talk about the Lyme vaccine?
Lyme vaccine. Lyme vaccine is relatively new on the market, and we have embraced it fully, okay? We do recommend starting a first Lyme vaccine at 4 months of age, and you will need to have a booster a month later, okay? We usually find the Lyme vaccines is a little bit pinchy, so a little bit more effect when you give the injection than, let's say, your regular other vaccinations, but I don't think we have seen any reactions at all. At Trenton Pet Hospital, we do like to, we try to do everything we can to reduce any possible reactions to our vaccinations. So sometimes if we see fit, we will actually separate Lyme vaccines from all other puppy vaccinations, or annual vaccinations. And the reason why we do is that if there is any reaction, I want to know what your pet is reacting to.
We need to isolate it.
Yeah, exactly. And all reactions which we, if we receive any reactions, we report them to the manufacturers, right? So if your pet, for example, this is the first year your pet is getting on a Lyme vaccine, the booster is a must. So they need to come back in 4 weeks. And the timing is pretty tight, so cannot be 5, cannot be 6, it has to be 4 weeks and to do its booster. You don't have to pay for the whole, we actually created a separate fee to make it as affordable as possible. All our health plans include Lyme vaccine and Lyme vaccine boosters, all of them, because we truly believe this is a standard of medicine in our area. Okay, so does that explain? Does that?
I think so. Yeah, I mean it's pretty quick, and I think between the vaccine and the actual prevention, something like Bravecto, or the combination is what's going to give you the biggest protection. So it's what we recommend. It's clear across the board. One thing that I did not know, again, before starting working for Dr. Ginny in veterinary medicine, is I didn't realize that cats could not get Lyme disease.
Yes, isn't that amazing? So cats do get ticks, but they do not get Lyme disease.
So
right?
Your cat could bring a tick in.
Yes.
And the tick could get to your dog and bite your dog and give your dog Lyme disease, but the cat's fine. Cat gets a free pass.
I do have to say though that the ticks in our area which carry Lyme disease do not like to stay inside. They actually will die faster when they're inside, okay? If you see a tick actually being live and moving inside your house, and you have recently traveled to the States, you may have brought some Rhipicephalus tick, which is a brown dog tick, which is a nasty piece of work. You need to kill that sucker right away.
I will say that one of the things that we always carry, and I personally keep in my vehicle, is a tick twister.
Yes.
So maybe, Dr. Jane, do you have any tips about removing a tick if you actually see it on your dog?
Absolutely. Number one, do not panic. I personally, I have a severe phobia of any, I don't think it's natural to have more than 4 legs, okay? It's just not okay. But anyway, so when you see a tick on your pet, my suggestion would be, I usually, if I were to remove it, I will put a drop of oil, any oil on it, and what you're going to do, you're filling up that spot, you're removing the oxygen, okay? Then you're going to use your tick twister. You're going to apply the tick twister underneath the head. So imagine right here.
It's like the back of a hammer.
Yes, right? And right here. And you're going to be very gently clockwise. You're going to be turning that twister. Take your time. Don't be fast, okay? You're going to turning that tick twister until the whole body, all the legs come out. So you know you've done a good job when the whole head is out. So what happens if you left the head behind and removed the body, decapitated the tick?
Which happens. I mean, they're tiny. I've seen it lots.
A lot of times that spot will get quite inflamed, and we usually recommend that we have special wipes, antibiotic. I think we talked about
We have them in our
this is when
emergency
you're gonna
kit,
get
yes.
an emergency kit
Yes.
out, and those wipes which are an emergency kit, just wipes that area. It has antibacterial in it, antifungal in it. Just wipes that area once a day. Majority of the time, the body is so wonderful, it will expel or it will dissolve that tick and get it out of the system, okay? So it is extremely likely that those areas become more than that, especially if, like, don't try to go with the needle, take it out, that's how you're gonna get an abscess. If you just kind of clean and keep that area clean and dry, you're good, you're good. It will disappear. I would say it would take a week, maybe even a couple of weeks for it to completely go away. But next important step, give us a call to schedule the Lyme test.
One of the last question I had was, it kind of goes back to what you were talking about a little bit at the beginning in terms of needing a prescription. You know, a number of clients have expressed concern and say, well, I want the prevention, but why do I need to see the veterinarian? Why can't I just have a prescription? Do you want to maybe talk to the importance and the reason why pets are required to see a DVM?
Actually, they are not required to see DVM, okay? They are required to be seen by a veterinary hospital, okay? So what that means is we actually have trained our registered technicians, and what we are doing, we want to make sure we take the weight. Appropriate weight is extremely important. Then the technician or myself will check over your pet, and we will make sure to go over the proper parasite control, okay? Yes, those medications are by prescription only, and the reason is if you are, for example, too young, right? Like, we may not recommend you to use those medications. If you have some medical conditions, we may not recommend you to use those medications. We may suggest to you some alternatives. What if your pet has a kidney disease? What if it has cancer? All of those things need to be taken into consideration because those are prescription medications. They are like done in a treat form, but the reality is there is actually a medication inside that treat, right? So that is the reason why you do want to have an established patient-veterinary client relationship to make sure that you can get dispensed this medication. Now, all you have to do is once a year, right? Once a year. That's all you need to do is show up once a year. Another thing is, if you have been seen in your hospital within that year and you have an up-to-date weight, that's very important. Up-to-date weight within that year, the hospital should have no problems dispensing you the medications for that whole year. Like, right, you know, whether you want the whole year prevention or whether you want it partially, that is fine. You don't need to bring your pet all the time. So we kind of tried our best to reduce the cost of getting your pet on the prevention. So
and a lot of the companies offer rebates.
Yeah.
You know, buying 2, 3, 4 boxes at a time.
But the way how we kind of facilitating that is by offering our registered technician appointments. So our technicians will take all the information, and if there are any red flags, they will always contact me, and you may end up needing to see me. But if everything is kind of black and white and no major concerns, and the cost would be half, right? At least half, it's no
less,
more.
yeah.
So at least get you to help. But yes, it is a cost per pet, because it doesn't matter how many pets you're gonna bring in. Every single one
They
of
all
them
need to be assessed.
will require exactly the same assessment, weight checks, talking about parasite control. Maybe your pet does. If your pet has been exposed to the ticks, you do need to run the tick testing to make sure that there is no Lyme disease going on already.
Out of curiosity, before we wrap up and before I tell you about a flash sale, one of the things, if I remember correctly, is that pets who are, so some clients love to read labels, they love to do research. And some clients have asked, you know, is something like Bravecto going to give my pet a seizure? I think that's maybe worthwhile
that's
discussing.
a very good one. Yeah, that's actually an excellent point. So, Bravecto, NexGard type of medication, Paraca, I believe they're all the same class of the parasite prevention medications. We do stay away from that class, from any pets who do have history of seizures or may be predisposed to seizures, okay? So while the products themselves do not cause seizures, what they do is they lower down the seizure threshold. Again, it happens one in, I don't know, 1,000 pets, but we just don't want to take any chances whatsoever.
And that's part of you coming in and us evaluating and having that discussion and finding those things out, as opposed to just, here's a script, here's a product, you know, threshold's lowered, your pet has a seizure, you blame the product. It's not, it doesn't necessarily always work that way.
Exactly. And I would say that in those cases, we will make sure that you still should be on some product to prevent your pet from ticks, but usually we probably would recommend like Advantix or something along those lines.
Give you another option.
We'll give you another option. Talking about Advantix, one thing is, which I think it's important, you should not be using Advantix if you have cats in a household, okay? Or if you're applying Advantix, do it the night before and separate the cats completely from any access to the
This
dog.
we've seen,
Advantix is severely toxic to cats. Cats will have violent seizures, not to mention possibility of maybe even dying, okay? So make sure that you are applying Advantix 3 spots, you know, like the night before, right before you go to bed, because it will be completely out of the topical, like touching kind of, within 8 hours. I recommend 8 hours.
It will be into the lipid layer
just
of the skin.
just to be on the safe side, 8 hours. The same goes with children, right? You know how our children like to hug our pet and then put their hands in the mouth. Well,
I've done it. I've accidentally touched my dog after applying it.
But it's very greasy. And you don't want your kids to have any chemicals on them. So the same thing. Put the product on your pet before you go to bed. That's usually the best. Before cat is in one room, children are in another room, and you have that 8 hours. Now, another interesting thing with Advantix is the more your pet bathes, so like grooming or swimming, the less effective Advantix is. So what that means is, even though it may say apply this product every 4 weeks, but if your pet is in the river, in a lake, every single day, that effectiveness will be much, much less. You may end up applying it like every couple of weeks, right? If no sooner.
Which again is why it's something that we ask. It's part of our questionnaires. It's just part of our intake.
Absolutely, absolutely. So keep those things in mind. Bravecto doesn't work that way.
No,
Bravecto is, once it sucks into the lipid layer of the skin, your pet can, you know, go and whatever to enjoy dog life, right? And it is not toxic to cats, okay? So that's another reason why we kind of went with Bravecto. Because I did like the topical portion of it, which is non-toxic.
And please, for the love of whoever you believe in, do not put the topical in your pet's mouth.
Oh, yes.
We have seen that as well. A chewable, looks like a treat, goes in the mouth. The only place the topical goes is down the neck, on the back.
And I usually recommend like on top of the head, right below it, and right there. So somewhere where your pet cannot reach to it. If you're using Bravecto on a cat, somewhere where they can't really lick it off. Because they will, I mean, cats are very sensitive as it is. If they taste Bravecto, of course, they will react.
I think that's it for questions. Did you have anything else that you wanted to add?
Well, let me have a look.
So I want to tell everybody about the Royal Canin flash sale.
So we talked a little bit about forgetfulness. So make sure whatever product you use, please program it in your phone.
Every 12
on
weeks.
your computer, on your Google Calendar. For Bravecto is every 12 weeks. For Advantix every 4 weeks. Again, not every month, every 4 weeks. if you have a dog over 40 kilograms, either go back to manufacturer or call us. We'll tell you how often you need to do. We talked a little bit about counterfeit products. If it's too good to be true, it is, okay? So DIN, D-I-N, is very important on all prescription products. So you should have, every flea and tick prevention product will have a DIN number. Oh, another one we didn't cover. What if my pet is indoors and never goes outside? Can they get Lyme disease? Absolutely, because guess who is not indoors? Well, I hope you guys are not, right? So yes, we can bring ticks, and this tiny little period of time, by the time we change our shoes and whatnot,
I've had more ticks on me than my dogs in the last year.
Yes.
They get in the socks, they get in all sorts of nooks and crannies.
In fact, a lot of people say, I wish we had the tick prevention for humans.
We've seen them. I can't remember who it was in the clinic. It was on someone's arm. They looked down and there was a tick on the arm, you know, because obviously we're interacting and we're touching pets. And I think this was one of our CSRs at front desk. And there was, you know, so they're everywhere.
And I would say there is actually a little sentence here. Skipping flea and tick prevention in winter is like skipping sunscreen on a cloudy day. The risk is still there, even if you can't see it. I thought that was very relevant.
It's a good, I think it's a good analogy. Yeah.
Okay, I think that's
well, I mean, there's so much we could continue. You know, I think at some point we obviously need to talk about, you know, fleas and mites and all that type of thing, and dewormer, and you know, some of these products do, you know, multiple things, for example. But for now, we're focused on tick-borne. I think we've given all the relevant information. As always, you can send us a DM to the page or email trentonpethospital@gmail.com. Of course, all of our contact information is on our website. You can text our phone number, so it's the same number, and we will get that and we can get back to you as well. Even if you have a topic for, you know, a discussion or a chat that you want to see, please send it to us. I am excited because pet food is extremely expensive. I know, I have 5 pets. It costs a fortune. And I think, as Dr. Ginny has talked about, when it comes to myths, we don't get kickbacks.
No,
we're not making money on pet food. It takes up a lot of room. It's heavy. We talk about it because it's important. That's why we have it. That's why we believe in it. But anything that we can do to save is amazing. So hopefully you know about our web store. It's myvetstore.ca. We attempt to sign every client up to My Vet Store and then favorite the food that is recommended to your pet. So Royal Canin offers, most of the companies will offer what's called an auto order discount. So if you set up a recurring order, you will get 5% off your order. They have come out as a flash sale between Friday, January 19th and Monday, January 22nd. So please put this in your phone or go on and change your auto order before you forget. They are automatically offering 25% off. So if you have an auto order, it's actually going to be 30% because they're giving you 25% off plus your 5%. If you just want to put in an order during that time and not do an auto order, you're still going to get your 25% off. And that's a 3-day thing only. And it's a one-time deal. I have not seen this in a few years. The only thing it excludes is what are called start of life diets. So any of the kitten and puppy diets. And it's for any of the prescription diets that you would find in clinic or on the store. So it doesn't matter if it's your first time purchasing it or you know, you've been purchasing it for a long time. Get in the savings. You can order multiple bags. Please save yourself some money. So again, that's on myvetstore.ca, which is linked on our web store, trentonpethospital.com, and that is up to 30% off Royal Canin food from the 19th to the 22nd of January. So hopefully you take advantage of that. I've got my auto order changed. I'm all stocked up, but I'm going to take advantage of the discount.
I think saying to that is a great time to stock up on the most expensive diets, such as allergenic, mobility support,
all the diets
skin
my pet
support.
eats. Yeah,
skin support. What a great opportunity. Thank you for letting me know. I'm gonna change my reorder time too. reorder date.
Yeah, absolutely important. Okay,
Yeah.
well, thank you, everyone. Again, Happy New Year. We're glad to be back to doing this. I think I know I do get some energy out of doing these, and it's nice to be able to sort of get further than beyond the clinic. You know, we're not just talking to Trenton Pet Hospital clients. This is for everyone, specific, you know, even in our area.
Feedback would be amazing.
Feedback,
Give us feedback,
tell us.
because if it's important to you and you find those sessions are valuable, those little chats are valuable, I'm sure we love. I love hearing it. I love reading it, and it does gives me a little bit more energy or more excitement to come up with our future topics. And we have a whole list.
We have a list,
topics
yeah,
we would
not
like
enough
to
time,
cover.
but we're doing it every other Wednesday, so the next one is not this Wednesday coming, it's the following. And we've already got topics lined up, so send us your feedback, send us your questions, and thanks for participating, thanks for watching.
Thank you for watching. Happy New Year.